My name is Zach. I'll be your nurse today.
Sorry, I didn't know what you were doing.
Set up a sterile field. Could you please state your name and date of birth for me? I'm going to ask the patient if I can take down his blanket so I can verify his identification using two different methods. Okay.
And I took off my
Now I'm going to close this curtain to give him privacy. Are you in any pain today? This is where he would tell me if he is or is not. And if he is, then I'll ask him what makes the pain better, what makes the pain worse. That way we can explore some non-pharmacological ways of easing his pain. That way we don't just have to pump him with pain medicine. So I will also ask if he has any allergies. Maybe he has a latex allergy, so then we would have to not use latex gloves or any other latex equipment. Alright, so today I will be assessing your wound and your wound dressing. So to get started, is it okay if I put this blue pad under you so that we can catch any extra fluid that runs down from the irrigation? He says yes.
Is there bath blanket? She has one. Can you give me one? Is that a bath blanket?
No.
Oh. What is it?
It's a blanket.
Why do you need it?
She doesn't have one.
Oh.
Whatever this thing
Thanks,
is.
I'm already struggling. Why are you being nice?
Come over on the other side. This is an abdominal wound. So I'm going to use two different blue pads, one on each side. If it were a leg wound, I would just use one and just set his leg over it. But we have a wider range that this irrigation fluid could fall to, so we need to cover two different areas.
Alright, any complete silence? I'll call it good. Alright. Would you mind giving me
All right.
Do you have any allergies?
Oh, you did?
So I've explained to him what I'm going to be doing. Now I'm going to begin setting up my sterile field. That way it's ready to go for, once I begin assessing his wound, my sterile field will be ready to go. I can start irrigating and assessing. Alright, is it okay if I set my basin on your bed? He says yes. So I'm going to start with the sterile drape. I have my trash can right here.
No, I saw you. It's in the Jesse size. He's in this art.
So what we're going to be doing today, Mr. Jones, is I'm going to be checking your dressing and assessing your wound, see how it's healing up. And I'll change it, clean it, and then irrigate the wound just to add more skin and loose and debris.
There's my sterile drape. Now I'm going to throw some sterile gauze in.
Are you in any pain today? Alright, well this should be a relatively painless procedure, but if you ever are in pain or uncomfortable,
And my syringe.
now I can apply, I can
I also would have wanted to make sure that this table was wiped down before I started preparing the sterile field on it.
there's no sign of drainage or odor to the wound, and really no signs of infection. I'm going to be measuring it now. It should be about 5 inches. Oh, wait. About 1 inch.
Okay, and I would usually have a sterile ABD pad that I would also empty off onto the sterile field. However, we are short on supplies, so I will be simulating a new ABD pad using the ABD pad that is on there right now. So after I take off his ABD pad that's on there right now, I'm going to drop it on the sterile field as if it was sterile, And when I have my sterile gloves and I'm putting a new one on, I'm gonna grab that and put it on as if it was sterile.
Take your gloves off. Notice you don't want to have dirty gloves.
Correct.
Correct. Oh, now you're touching this too.
Well, I have to pour this before.
I'm being careful not to reach over my sterile field, but rather reach around.
Alright,
I'm pretty sure. Hey, question. You can pour the solution without gloves on, right?
Yeah,
Okay,
they're just, it's
I'm
not
now ready
sterile.
to
The
take
outside
off
of the bottle is not
his
sterile
wound
already.
dressing. I need to make sure that I don't turn my
Make
back
sure you
to
check
my
the
sterile
cans,
field
too.
while I do this, because that would contaminate the sterile field. So to do this, I'm going to put clean gloves on.
time it. As I pour the same way, the first thing I'll do is check the expiration date. It is not expired and has not been poured, or has not been over 24 hours. It's supposed to be.
Alright, again, not completely turning my back to my sterile field. I'm going to pull back the blanket. Only going to pull it back enough
Close this and label
to give
the
myself
time and
enough
date
room to have a working area, but I'm going to cover up any perennial areas or anything like that to provide the patient with privacy. So I'm going to pull back the gown.
Before I actually apply the sterile field, I'll put in a waterproof pad.
And if it was a female patient, I would want to have a drape to cover the breast area, again to provide privacy. So, as I begin pulling off the dressing, I'm going to pull off all the pieces of tape.
That should do just well. I will now prepare my sterile.
And when I pull off the dressing, I'm going to want to go from bottom to top. That way I am obstructing the patient's view from their wound. It might make them squeamish, so we don't want them to see their
The outer one
their wound.
sterile field is not
So this is my ABD pad. I'm going to act as if this is sterile, and when I open up the package, I'm going to drop it on the sterile field. So now that the wound is open, I'm going to start assessing it by taking the diameter of it. I can also measure the length with this. I want to hang at least an inch above the wound to remain sterile.
So like, I think for
And I'm now going to take my gloves off.
Or you don't have to show it, you can just say now in school.
And before I put my sterile gloves on, I'm going to take my watch off. So I did forget something for the sterile field. I just need to open this up. This is going to be my wet gauze. And I'm going to grab the sterile solution and I'm going to hold the label on the inside of my palm, open this up, pour the first little bit out into the trash, and then I'm going to pour the whole fluid into the gauze. If I don't use all of it, I'm going to want to date and time the last time it was opened, last time it was used. I'm also going to open this up. This is going to be the fluid I use my syringe and withdraw fluid from. And done with that. Going to prepare tape for my new ABD pad.
Sterile gloves off the sterile field.
So like we can do like the voice.
And that's all the tape I have. So we will again have to simulate tape.
I mean, because you're just talking to nobody.
In a real hospital setting, I would not leave my sterile field because I don't want it to become contaminated. I would instead hit the call button on the patient's bed to have another nurse bring me some more tape. Okay, so now that I would have 4 pieces of tape laying here, I would date and time one of the pieces of tape. That way when I put it on the dressing, the next nurse that comes in will know the last time that I the last time that the dressing was changed. Okay, so I will now begin donning my sterile gloves.
But with my now gloved hand, I reach inside my non-dominant hand.
Is it okay if I use your bed to don my sterile gloves? He says yes.
I just broke sterile technique because I touched the outside of my glove. So I'll be reapplying.
All right.
Not going well at all. Okay, so I guess I need to.
Clean all that up.
Well, like, it all went downhill when I put my sterile fluid down and then didn't have room for everything else.
I have another question. How are you supposed to irrigate this and make this all filled up right? Like, we're taking
So
this
for
side.
a sonic wound,
Okay, so I have 2 fingers in the same finger hole. I'm going to put on my other sterile glove, and once I have both sterile gloves on, I will be able to touch and readjust.
flow out underneath it. Okay. Okay.
Based on the whole house, can you take it?
There's just so much stuff.
Okay, my sterile gloves are on.
Yeah, it's
I am now going to, first off, assess the wound visually. So I'm looking for arrhythmia, I'm looking for drainage, I'm feeling around the wound to look for heat. Heat is a sign of infection. Now I will begin going to pass this over to my left hand, and I'm going to check the depth of the wound. The way I'm going to measure the depth is I'm going to use body fluid to mark the Q-tip. I'm going to come over here. I already have this prepared. I'm going to set it next to the ruler that I have and measure the length of that. And now I'll grab another one. I should have done this with the one before. I'm going to dip it into some sterile fluid.
Miss him.
And I'm going to check for tunneling, measuring the length of the tunneling the same way I did before, holding it up to the ruler I have there.
You always say.
Alright, I'm now going to irrigate the wound. So I'm going to grab this,
I think I just gotta start over.
stick it in the fluid over here, withdraw some sterile fluid, and I'm going to start from top to bottom, hanging at least an inch above the wound. And I'm going to irrigate until all the fluid from the wound runs clear. After I'm done with that, it's now time to clean the wound. So I'm going to start with wet gauze. And this is wet, so I'm going to squeeze a little bit of it out. And I'm going to start from top to bottom, inner to outer. So I'm going to start right here. I'm going to wipe out. I'm going to throw that away, grab a new one. I'm going to use a new gauze pad every time that I come and wipe the wound. And also after the first time, because I wiped with this hand, this glove is no longer sterile. So after I throw this away, I grab a new glove or a new gauze.
And then we'll replace the dressing. Are you in any pain today?
I'm going to have to drop
Well, that's good.
it into this
This
hand
should be a relatively
and
painless
continue
procedure, but if you ever are in pain,
using
go
a
ahead.
new piece of gauze every time I
I've
wipe.
got my gown
I'm
on.
going to go
I'm going to be putting on a mask.
both sides.
Here's a goggle, just because I'll be dealing with the wind.
Okay, the wound is now clean, so I'm going to continue using wet gauze. I'm going to pack the wound. So
I'm okay to remove the dressing.
this gauze is wet. We want to keep it wet because we're going to put it into the center of the wound, which is where we need the gauze to be wet because that promotes wound healing. It's having a moist wound bed. So I'm going to squeeze out the excess fluid just a little bit, not too much. Drop that into this hand, and I'm going to pack the wound.
Let's begin.
So if the wound was bigger, I would use the wet gauze going moist to dry. So that was a moist gauze pad. I'm going to use more dry, so I'm going to take this gauze pad and I'm going to squeeze the majority of the liquid out, and that's what's going to go on top. Okay, we now have the wound pad. I'm going to grab some dry gauze,
About 3 inches deep.
and drop that into my hand. I'm going to dry
Setting up my sterile field. And then we'll
the wound area.
irrigate it.
I know, like,
And we'll go from there.
Or like text it to
So the first thing I'll do is set up my sterile field.
in your spare time, you should try video.
Okay. Now, while I'm doing this, I'm going to be communicating with the patient, also looking at his face and his chest movements to look for increased breath rate. These are all signs of being in pain, so we want to make sure we're minimizing the pain that we're inflicting on our patient. Okay, so now that that is complete, we are going to grab our sterile ABD pad. And we are going to set that right there.
I'm going to go ahead and pour.
Grab our tape.
This is a sterile basin.
No, I wanted to.
They're not looking at the. Let's set this in my sterile field. Check the date for when this saline was used. It is not expired.
And we would grab our other 2 pieces of tape and finish that off. I'm now going to take my sterile gloves off by using my dominant hand to pinch the outside of my non-dominant hand. I'm going to pull this off,
Put on my sterile gloves.
crumple that up in my dominant hand, and slip a finger under here, taking off my gloves while not touching the outside surface of the gloves. Okay, I'm going to go ahead and clean up my sterile field. I'm done with my sterile field. Do not need it anymore.
Oh wait, no, yeah, it goes like that.
Save that gauze. Maybe I'll need it.
You were confused.
Okay, now I'll cover the patient back up.
Inside of the glove.
it always comes up and gets in my eye.
I know. and
Now
then
we'll take out my blue pads. These are going to have fluid on them, so you want to roll them up
for the irrigation.
so that the inner surface is not on the outside. See, I'm grabbing the blue surface, which is the outside of it.
For both of them. So we don't need these, do we?
I don't need those clothes on, it's just the little, right? Because the outer inches of those are.
We are going to cover the patient back up, make sure they're in a comfortable position.
All right.
If not, we can adjust the positioning of the bed. And when you're done, you want to make sure that the bed itself is in the lowest position, which it is. This was a comfortable working position for myself, but if you're taller, you need a more comfortable working position. You could have raised the bed to where the wound would be just right here. I was comfortable with working in the lowest setting, but when you're all done, make sure the bed is on the lowest setting as a safety precaution. Use hand hygiene.
We've got a basin over here.
Make sure one last time the patient is in no pain and that they are in a comfortable position.
I'll place this on
Grab their call light, set it next to them if they need you, and that's it.